Hey guys, just wanted to follow through on my promise to do a little review. I'm going to hopefully share my screen. It's going to look weird, but I was going to pull this up. Okay. So to kind of break down what you need to know a little better, and then hopefully that will help. Okay. So for endocrine, this is something that I taught, and I feel like that I covered the topic pretty well, but just to kind of give you a little more in-depth spiel, if you will, you do need to know the differences between hypothyroidism and hyperthyroidism, what they entail, what the patient is going to look like. Really focus on signs and symptoms of myxedema, coma, and thyroid storm, okay? Because those are super specific to each ailment, and so you may or may not be tested on that. So make sure you know those for, like, as far as medications are concerned, what I want you to know is like what would happen if, for example, what would happen if, you know, the patient stopped taking the medication or was taking the medications inappropriately, things like that. What might you want to educate the patient on specifically about taking their medication, you know, that it's a lifelong treatment, things like that. Surgical interventions, of course, are going to be your thyroidectomies. Now remember that if they have a total thyroidectomy, that means they are not only taking the thyroid, but they're taking the parathyroid as well. And as I hope you guys know, the parathyroid is responsible for calcium. And so maybe you might want to look at signs and symptoms of like hypocalcemia and what that means. So there's your kind of clue there. For hypo, and I wrote this on the wrong thing, so I'm kind of glad I'm doing a video over it. As far as heart involvement is concerned, so remember for hyperthyroidism, everything's going to be sped up. But for hypothyroidism, everything's going to slow down. So there's going to be a decrease maybe in cardiac output or an increase in cardiac output, respectively, if you're looking at hyperthyroidism. So that may be something that you guys need to take a better look at and focus a little more on. And then as well as radioactive iodine therapy and the potential side effects of that. So usually what happens is they can develop symptoms of hypothyroid for the radioactive therapies. So that may be something that you need to look at as well and kind of explore. As far as Addison's, the big thing is nutrition. Remember, they're going to need a high salt diet, high calories to keep up with the demand there. As far as clinical manifestations, what I'm mainly looking for here is Addisonian's crisis. Like, what is your patient going to look like if they're in an Addisonian's crisis? And then what you might want to educate your patient on. And again, that kind of goes hand in hand with nutrition and nursing intervention, because remember, education is a nursing intervention. For Cushing's, I want you to know risk factors. The main issue with Cushing's, remember, is that there is an overproduction of glucocorticosteroids, okay, in the body. So what that means is something is making it overproduce one of those hormones, right? So when we're looking at that, the number one key, sorry, my brain broke. The number one key thing that actually causes this is a prolonged use of steroids such as prednisone or dexamethasone or solumedrol or something, some type of steroid, okay? Yes, with pituitary tumors, 80% of all people who have pituitary tumors can develop Cushing's. However, pituitary tumors are rather rare. So the main thing that the takeaway that I want you guys to take from that is there's going to be an excess of steroids. As far as education, depending on if they have surgical intervention, which sometimes they do, and they have their adrenals taken out, so those little top hats that sit on top of the kidneys, right? So if they have a procedure, a surgical procedure where that is removed, then, you know, there's no production of glucocorticoids, okay? So that means that we may have to supplement them with those, okay? Graves' disease and Hashimoto's, just know the signs and symptoms of those. That's the main thing I want you to know there. For thyroid, it's education, post-op care. If I know I said it in the lecture, but I'll remind you again, when a patient has a thyroidectomy, whether it's parathyroid, total thyroid, partial, whatever, they need to have a trach tray in the room. They must have oxygen in the room, and they must have suction in the room. Those are super, super important. Again, complications for thyroid disorders are going to be like your hypocalcemia, especially if the whole thyroid is taken out. And then, of course, your labs, which are your TSH, which is your thyroid stimulating hormone, and then your T3 and T4. So remember, in hypothyroidism, the TSH is actually going to be elevated. And in hyperthyroidism, the TSH is actually going to be in hyper, it's going to be low. So there's a little bit of an inverse relationship there. And that's pretty much all you need to know about thyroid and Addison's and Cushing's. So hopefully this is helping. Okay, neuro. So we've got strokes, cerebral vascular accidents, which is basically the same thing. Remember, there's left-sided and right-sided. You need to know, and I know that Miss Jarridge emailed you guys about the differences of left and right-sided strokes and the page number it's on. For the life of me right now, I can't remember. But you should have that in your email. Please look at that, okay? And then, of course, your TIAs as well. The big thing here is going to be medication. So what are they going to be taking? Remember, blood thinners. So we've got aspirin, we've got Plavix, we've got maybe warfarin, just depending on. Pretty much what we're doing is we're thinning their blood enough to prevent the TIAs from becoming full-blown strokes, okay? You're going to want to know about diet, okay? So some things may cause constipation. What are, maybe what are some teaching methods we could tell our patient about to prevent constipation and things like that. Nursing interventions, remember, for stroke, the biggest thing here we want to talk about is safety. Safety, 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 safety. Okay, is your patient being safe? So what that means is, are we putting the call light on the right side, or on the correct side, rather? Are we making sure that they understand us when we're giving them direction? So that kind of falls into communication. Super important how you're going to talk to your patient after they've had a stroke, depending on if they have any like expressive aphasia or anything like that. And then what we're going to teach what we're going to teach the patient and the patient's family. So a lot of times when a patient has a stroke and the family wants to do everything for them, it's not really conducive to the patient's recovery or learning process. So there may be a deficit there. So kind of keep those things in mind. Remember, all of these questions are going to be application, okay? We don't want to just know like what you guys know. We want to know how you're going to use that knowledge and apply it to your patient, okay, or your nursing care. So kind of think about that. And remember, when I'm in love with test-taking strategies. Remember that if you have a priority question or something like what you're going to do first with your patient, you need to plug everything that you answer back into the question and ask yourself, does this make sense? Does my answer make sense, or does it address the question? So that can be super helpful. And then, of course, with the select all that apply, make sure you cover your answers one by one and ask yourself, is this true or is this false? Those are going to be big ones, because you will have, I believe it looks like 6 to 8 priority questions off the top of my hand. I can't really remember the exact number, but and it's a smattering of all of these things. So hepatobiliary, seizures, Parkinson's, myasthenia gravis, all of the components. So make sure you know those well. Okay. Neuro part 2. So seizures. Okay, you need to know the types, the differences between like a tonic-clonic seizure and a focal seizure. One of your questions on the quiz was, what can you anticipate your patient who has a focal seizure to look like? I'm paraphrasing here, but remember, it's the lip smacking. It's not so much the convulsing. It's the small things like staring off into space or things like that. Nursing interventions for seizures, what are we going to do? So if we put a patient on seizure precautions, what does that look like? Do we need to pad the side rails? Do we need to, maybe place them closer to the nurse's station? Do we, all of the, like, do we not put anything in their mouth, or do we have suction set up? Things like that. Medications, these are going to be like your Dilantin, your Ativan, especially if a patient is having an active seizure. That's going to be the main medication that you're going to give. And then educating the patient mainly on their medications and compliance, okay? Because if they're taking their medications properly, then they should have a pretty good control of their symptoms, okay? As long as they're taking their medication properly, they shouldn't have any issue with, in theory, they shouldn't have exacerbations or complications or things like that. Parkinson's, remember, this is, there's a lack of dopamine that is produced, okay, in the brain. So these patients are going to have those pill rolling tremors. They're going to, they're going to have a shuffling gait. They're going to, like, their center of gravity is now in their trunk, so they're going to be leaning forward. So again, safety is a big issue with these patients. As far as diet and nutrition goes, making sure that, they eat small, frequent meals, because, this is a traumatic thing for them. If they have pretty course-like tremors and they're trying to feed themselves, they may get frustrated. So small snacking, frequent meals while maintaining their safety, super important. Nursing interventions for these patients, really, again, safety and making sure that we promote their activities of daily living. This is super important. These patients have lost a lot of their independence because of their Parkinson's issue, and it's hard. It's a terrible degenerative disease, and so any autonomy you can give the patient is the best course of treatment. Education, mainly with medications. So as you know, and I'm sure that Mrs. Lewis has talked about this, carbidopa, levodopa is pretty much the standard medication that you give. Okay, so you're gonna want to look at signs and symptoms, maybe of adverse side effects, or maybe if the medication isn't working, do we need to, change medications or whatever the case may be. Myasthenia gravis, so this is basically gradual paralysis starting from the head down, as opposed to Guillain-Barré, which I know you guys didn't talk about, but it's still good to know, starts from the toes up. Okay, so how are we going to assess these patients? They're going to have muscle weakness. They're going to have, progressive paralysis. So we want to make sure, because you start from the head down, we really want to focus on their airway. And speaking of airway, which I didn't mention in Neuro Part 1, that's one of the main things that we want to do is maintain their airway if they've had a stroke. So with myasthenia gravis, again, we want to make sure that we maintain their airway. Another thing that we want to make sure that we do is promote having them do their activities of daily living like early in the morning, because muscles are strongest in the morning. So trying to do all of their activities early in the morning when they have the strength to do them, those things are going to be super important. As far as complications go, ptosis, P-T-O-S-I-S. Okay, that's the drooping of the eyelids, right? Okay, you want to know about that. You want to know what that entails and how you would treat that. And then again, mostly educating the patient on safety and how to preserve their muscle function. Multiple sclerosis. Again, they're pretty much the same thing. So that's the demyelination of the myelin sheath. So what happens is there's no lubricant in those cells, okay, those little axons and everything where the messages get carried through. So that way it slows everything down and your movements are less coordinated. You're less likely to be able to control your movements. Which is super important, because as human beings, all we do is move around. So with these patients, you want to do a good, thorough assessment. Exacerbation treatment and causes. This is super important. The number one exacerbation issue, or what causes the multiple sclerosis to have an exacerbation of this, is any type of infection. That's usually the main cause of an exacerbation. So we want to make sure that we keep these patients infection-free, and especially if they're not able to move, like let's say they're wheelchair-bound or something like that, making sure we turn and position them and things like that to prevent bed sores, to prevent infection later on. And that, again, it goes with nursing interventions. And then, of course, the types. I listed the 4 types, and I believe Elena Chapa sent them out to you. Just know what they are, essentially. And then same thing with education and nursing intervention. You want to just make sure you maintain their safety and make sure that you keep them free of infection and things like that. For hepatobiliary, so make sure you know your types of hepatitis. Okay, so hepatitis A, viral hepatitis, B and C. So B and C are bloodborne, right, as opposed to A being foodborne. And it's usually, for the foodborne, usually causes like diarrhea, and it's just not a good time. Okay, so making sure that when they're going overseas, or they're, eating foods like uncooked foods or something, making sure that they know the risks for that. Of course, hepatitis C, as we know, and as you guys should know, is the most prevalent for cancer, okay, most likely to cause cancer. Of course, you have your hepatitis B series of vaccines. There's also Hep A. Hep A doesn't occur very often in the United States because we have cleanly, we have, we use aseptic technique, but like if you travel abroad and things like that, you're more likely to transmit it or get it, essentially. Education, again, making sure patients know, hey, this, if you cross-contaminate your blood or if you get a cut or something and you're, doing something where another person has a cut and they potentially have those, you can get hepatitis B or C. And then, of course, again, like I said, hepatitis A is foodborne. Cirrhosis and liver failure. So medications for cirrhosis. The number one thing, what usually happens, two complications that are fairly common in people who have cirrhosis or liver failure are hepatic encephalopathy and a buildup of ammonia, okay, in the body, because our livers naturally produce this. So what happens when it's not working? We can't get rid of it. So for an increased ammonia level, the number one medication that we give is lactulose. And remember, lactulose is a laxative. So what it does is it actually helps the ammonia bind to the stool, and then you can excrete it through your bowels, essentially, through your encephalopathy. Again, they're gonna, with an increase of ammonia, you can get encephalopathy, which is building up of fluid in the body, okay, that can correlate into your brain, so it can make you very lethargic. So maintaining their airway, their safety is going to be a big thing. Adhering to their medications. The lactulose is not fun, okay, but they need to take it in order to decrease the risk of getting hepatic encephalopathy and a buildup of ammonia. Nursing interventions. How are we going to take care of these patients? Again, we're going to make sure that we maintain their safety. If you suspect hepatic encephalopathy, doing a thorough neuro assessment, making sure that they adhere to their medication and things like that, keeping their fluid and electrolytes balanced as well is super important, because not only can you lose ammonia through the stool, but you can also lose potassium and other nutrients. Okay, pancreatitis. Okay, pancreatitis, so this is inflammation of the pancreas. So the big thing here is the pancreas is actually digesting itself, which is kind of crazy. So it's basically eating itself, okay? So the thing I want you to look at is labs. What labs correlate with pancreatitis? So you're going to have an increase of amylase and an increase of lipase. Those are going to be your pancreatic enzymes. The way we treat this is we make the patient NPO. We rest that gut. We don't want to introduce anything into that stomach that is going to increase the secretion of those pancreatic enzymes, because of increased food intake, increased pain. Okay, so the main things we want to do is we want to rest the gut. We may have to put in an NG tube, just depending on what's going on with the patient, especially if they're, if nothing's moving and they're vomiting or something like that, to decompress that bowel. And then we're going to provide pain management. That's super, super big. Okay, these patients generally have generalized abdominal pain, sometimes in the left that radiates to the back, but it can happen all over, and it is very painful. So making sure that you take care of those patients and give their medications on time, because it is excruciatingly painful. And of course, the biggest cause of pancreatitis is going to be excess alcohol consumption. So educating the patient to decrease their alcohol intake or stop it completely is best, within reason. Cholecystitis, so this is inflammation of the gallbladder. Okay, so it's the gallbladder is sick. Medications again for nausea, vomiting, pain management. Okay, surgical interventions would include taking out the gallbladder would be number one, an ERCP or an MRCP where they physically go in and they retrieve any stones if they have cholelithiasis. Nursing interventions, again, we're gonna make sure that they that their pain is being managed, and also additionally, you want to educate the patient on what foods to avoid. So we're going to avoid foods that are fatty because it can actually exacerbate cholecystitis symptoms. Now, not all patients are able to get surgery. Some may be treated with antibiotics. And then staying away from trigger foods. Again, those are going to be mostly your fats. Okay. For math, I promised I would go, I promised one of you guys I would kind of go over this. I'm not very good at math, so the way I do it, I've noticed, is not the way that you guys do it. So I'm not going to do examples because the way I do it may just confuse you. So what I am going to tell you is there's 5 math questions, okay? And they're simple math. Most of them are converting milligrams to milliliters, okay? There is a question that you have to convert pounds to kilograms. And I will tell you, please listen to me when I say this, even though it says round to the 10th, when you're converting your pounds to kilograms, just give me the whole number, okay? And then, of course, your priority questions. So those are going to be, who are you going to see first? Remember, you have to think about what's going to kill my patient first, okay? What's going to cause my patient harm if I don't address this immediately? Okay, and like I said, there's questions about all of the topics as far as priority. So if you've done your disease process sheets and you've kind of filled out this this blueprint, then you guys should be fine. There is a bonus question. I will tell you it is something that I talked about in my lecture. Okay, it's just a fill in the blank, fun little thing. So I hope that this helps, and I hope that this has given you a little more clarity on what we're looking for on the exam, because I really do want you guys to do well, but I also don't want to give you all the answers because that would just be inappropriate. So I hope that this helps, and I hope that you guys have time to, or have had time to watch it. And if you guys have any additional questions before the exam or in the meantime, then please do not hesitate to reach out to me, and I will do my best to answer any questions that you may have. All right, thanks, guys.